Let's talk about one of the most common medications in the entire world, the birth control pill. You know it as the pill, but it turns out it has this whole secret life that goes way, way beyond its name. And that's what we're going to dig into. So, let me just ask you a super simple question. What is the pill actually for? I mean, the answer seems pretty obvious, right? It's right there in the name, birth control. But the real answer? Oh, it's for so much more than you probably think.
To really get this, we've got to start with a pretty surprising fact about who's using the pill. And, more importantly, why.
Okay, get this. A staggering 58% of women who use the pill are on it for reasons other than or in addition to birth control. Yeah, that's a majority. For millions of people, its main purpose is actually therapeutic. And this really gets at a huge shift in how doctors are looking at it now. It's becoming less about just contraception and more of a foundational tool for managing the body's super complex hormonal system. So if it's not just for preventing pregnancy, what exactly is in this hormonal toolkit? Well, let's look at two of the most common and serious conditions that it's used to treat. First up is polycystic ovary syndrome, or PCOS for short. This is a really complex hormonal disorder that affects millions and millions of women all over the world. And what's wild is that PCOS isn't just one thing. It's like this whole cascade of symptoms. We're talking everything from irregular cycles and really painful cysts to things like severe acne, all because the body's hormones are out of balance. So how does the pill fight back? Well, it steps in to directly counteract these problems. By giving the body a steady, controlled dose of hormones, it basically forces a regular cycle. It also lowers those excess androgen levels that cause issues like acne. It's a really targeted hormonal fix. Then there's endometriosis. This is an incredibly painful condition where tissue that's supposed to be inside the uterus starts growing where it shouldn't, and that causes a ton of inflammation and chronic, debilitating pain. The pill's approach here is a little different, but it's just as direct. By suppressing menstruation and making the uterine lining thinner, hormonal contraceptives essentially starve those misplaced tissue growths of the hormones they need to grow. And for many, that means serious pain relief. Okay, this all sounds incredibly powerful, I know. But what's actually going on here? I mean, how can one little pill do so many different things? You know, the simplest way to think about it is this. Hormonal contraceptives basically take control of the conversation happening between your brain and your ovaries. So here's the play-by-play. First, you introduce the synthetic hormones from the pill into your system. Your brain sees this and thinks, whoa, okay, hormone levels are high, we're good. So it stops sending out the signals that tell the ovaries to get an egg ready. Ovulation gets put on pause, and just like that, the crazy hormonal roller coaster of a typical cycle just levels out. Everything stabilizes. But, you know, like any medication that's this effective, that level of control comes with its own set of trade-offs. It's so important to look at both sides of the coin here. And this gives us a really clear, balanced look. On the one hand, the rewards. You've got life-changing symptom management for conditions like PCOS and endometriosis, predictable cycles, and even a lower risk of certain cancers. But on the other hand, there are known risks, things like a slightly higher chance of blood clots, the potential for mood changes, and other side effects that are different for everyone. And that right there is why this is so crucial. Deciding to use hormonal contraceptives is never one-size-fits-all thing. It's a deeply personal calculation of risks versus rewards, and it's a conversation you have to have with a doctor. So when we pull all the way back and look at the big picture, what's the real takeaway? The pill isn't just some lifestyle choice. It's become a pillar of modern medicine. I mean, this chart really says it all. Sure, preventing pregnancy is still the #1 reason at 58%, but look at the rest. 31% of users need it for menstrual pain, 14% for acne, and 7% for these really serious conditions like endometriosis and PCOS. It's a true medical multi-tool. Ultimately, this is what the pill has become. It's a cornerstone of modern endocrinology, the study of hormones. It's a tool that has given millions and millions of people more control over their bodies and their health in a really profound way. Which kind of leaves us with one final big question to think about. If this one class of medicine, which was developed over 60 years ago, can manage so many different things just by stabilizing our hormones, what does the future hold? What does the next generation of more precise, more personalized hormonal therapy even look like? What comes next?